Hello, I'm Diane Sawyer, and welcome to the conversation. Ask Jon Karl, who's our congressional correspondent, to come in and tell us about this hair-raising last few days in healthcare reform, with all the argument, all the frustration, all the accusations out there, and what in the end happens. So, Jon, how you feeling?
Great.
Long weekend.
This is the second 1 a.m. vote we've had in the Senate in the last week. You don't usually see this stuff.
No. So take us inside the room. What would we have noticed? What stays in your mind from this?
Well, first of all, keep in mind we had this snowstorm, one of the biggest ever in Washington,
Right.
and the city is still paralyzed. The federal government still, this morning, is closed down, except for the Senate. So you had all 100 United States senators showing up after midnight for a vote. Coming in, a 92-year-old Robert Byrd had to come in a four-wheel drive, big SUV from his Northern Virginia home, braving those roads, which
And
were
is he in a wheelchair being wheeled into the chamber?
wheeled into the Senate to cast his vote. You had two senators that were stuck in New Jersey, and they had to send government planes up to get them in. It was, just a really a great achievement for both Democrats and Republicans just to actually get everybody to show up for this vote, and it was 100% attendance.
And all of us have been talking this morning about the sausage making here, and we're talking the process itself. Is this what goes on in every bill and we just haven't paid this kind of attention? Or the fact that Senator Nelson and Landrieu, that they come away with these incredible deals they got to make in the last minute, is that unusual? How do we react to that?
Well, it is what happens frequently. The last room, you got to get those final votes. You do what you do. You give favors here, project there, project here. But, Diane, we've never had a bill come up of this magnitude, and you had so much pressure at the end on just a handful of senators, and they were able to call the shots.
I want to get to some of the questions we've been asked online, because we want to try to take this as much as we can, question by question, and provide answers, because we know everybody gets lost in this welter of information. Here's one. It's from Iconlast, or Iconklast. Hello out there. Sorry if I mispronounced it. I would like to see the range of premiums based on income bracket, and when will the plan kick in? What do you say to people who want to know, will this hold down my premiums? Will they go up immediately, and when does it kick in?
Well, first of all, most of this kicks in 2014, and a lot of those really specific questions, like how much are these health care plans going to cost me, we don't know yet.
So take a wild guess for me. How many members of the House and the Senate do you think actually know everything in this bill?
It'd be hard to put a number, but I would say it'd be a very, very low number. I think that we could surprise virtually any of the 535 with an aspect of this bill. I would find it amazing to think that any one of our elected officials truly knew in detail everything that's in this bill. That would be almost superhuman. Maybe some staff. There's some brilliant staff out there that have done nothing but write this bill.
Okay, thanks so much, Jon. Back to work for you and us here.
Thanks. We'll see you tonight.
For tonight. So we are taking your questions. We're looking at them. We're going to pick out the most important ones and try to answer them in a clear way tonight. So if you have questions for us, send them in right now. It's twitter.com, ABC World News. See you tonight.